Flesh-eating bacteria, the silent killer. Hiding in water. Every year, more and more people are falling victim to a hidden danger lurking in our waters. Flesh-eating bacteria, scientifically known as necrotizing fasciitis, is responsible for hundreds of infections annually in the United States alone. In 2023, over 700 cases were reported, with a significant number linked to recreational water activities like swimming, boating, and fishing. What is more alarming is that these numbers are on the rise, with fatalities occurring in almost 1 in 5 cases. This silent killer is not just a problem in warm tropical waters, but is being reported more frequently in places once thought to be safe. So what exactly is this flesh-eating bacteria, and why is it becoming a growing threat? Flesh-eating bacteria is a term commonly used to describe a severe, rapidly spreading infection called necrotizing fasciitis. Despite its terrifying name, this condition is not caused by a single type of bacteria. Instead, it can be triggered by several different bacteria, including Streptococcus pyogenes, Vibrio vulnificus, and Staphylococcus aureus. Among these, Vibrio vulnificus is one of the most concerning because it thrives in warm, brackish waters and salt water, making it particularly dangerous during the summer months when people are more likely to engage in water activities. So, how does it mess with the body? These bacteria enter the body through breaks in the skin, whether it is a small cut, scrape, or an open wound, and rapidly destroy the tissue surrounding muscles, nerves, fat, and blood vessels. In severe cases, the infection can spread within hours, leading to shock, organ failure, and even death if not treated promptly. But what exactly causes this to happen? The bacteria thrive in warm, salty, or brackish water, particularly in coastal areas and estuaries. Even slightly elevated water temperatures can create ideal conditions for these pathogens to multiply. When someone with a compromised immune system or an open wound comes into contact with contaminated water, bacteria can quickly invade. For instance, Vibrio vulnificus can enter through a minor cut or scrape, or even through ingestion of contaminated seafood, like raw or undercooked oysters. In recent years, cases have also been reported following floods or hurricanes, where contaminated water comes into contact with wounds. So, what signs should you look out for with this disease? Symptoms can start with mild redness or swelling around the wound site, but within hours, the pain becomes excruciating, far worse than what's visually apparent on the skin. This is because the bacteria are aggressively destroying tissue beneath the surface. Fever, chills, and a feeling of being severely unwell often follow. The pain is often described as out of proportion to what you see on the skin. If you notice this type of intense pain, along with rapid swelling, redness, or darkening of the skin, it is important to seek medical help immediately. Necrotizing fasciitis can become life-threatening very quickly, and the earlier the treatment, the better the chances of survival. Once inside, the bacteria release toxins that destroy soft tissue and hinder the body's ability to fight the infection. The body's immune response, instead of helping, can sometimes worsen the situation, causing inflammation and clotting that damages blood vessels, cutting off blood supply to vital areas. This results in tissue death, which may require surgical removal or, in severe cases, amputation to stop the spread. But do you know what the usual treatments for this dangerous disease are? Treatment usually involves powerful antibiotics administered directly into the bloodstream and surgical intervention to remove infected tissue. Despite advances in medical care, the fatality rate for necrotizing fasciitis remains alarmingly high, particularly if treatment is delayed. While flesh-eating bacteria have always been present in the environment, their prevalence is rising due to warming water temperatures, increased pollution, and more frequent extreme weather events. Many reported cases involve people who were simply enjoying a day at the beach, wading in shallow waters, or fishing. Yet these seemingly harmless activities can have devastating consequences. Let's see how you can protect yourself and your loved ones from this deadly pathogen. You should avoid water with open wounds. If you have cuts, scrapes, or any open wounds, avoid swimming or wading in lakes, rivers, or the ocean. This is one of the easiest ways to reduce your risk of infection. Always cover up yourself. If you must be in the water with a wound, use waterproof bandages to cover it. These can provide a barrier between your skin and potential bacteria. You should stay informed and mindful. Pay attention to public health advisories and warnings about water quality, especially in coastal areas. Local health departments often issue alerts if harmful bacteria levels are detected. Always do proper wound care. Clean all wounds immediately with soap and water, even minor ones. This is particularly important if you've been in natural bodies of water. Do not forget to handle seafood with care. When handling raw seafood, especially shellfish, use gloves if you have any open cuts. Cook seafood thoroughly before consuming it to kill any harmful bacteria. You should know the symptoms. Recognize the signs of necrotizing fasciitis, severe pain, swelling, fever, and changes in the color of the skin around a wound. Time is critical. Seeking medical attention quickly can be the difference between life and death. While the risk of flesh-eating bacteria might seem terrifying, it is important to remember that awareness and precaution are your best defenses. Millions of people enjoy our beautiful beaches, lakes, and rivers every year without incident. By staying informed and taking a few simple steps, you can significantly reduce your risk and enjoy the water safely. Thank you for watching this video. If you found it useful, please like, share, and subscribe to our channel for more informative content. Stay safe, stay informed, and see you in the next video.